Hello, everyone. My name is Dr. Joanna Ghobrial. I am the Director of Adult Congenital Heart Disease. I specialize in adult congenital heart disease as well as interventional cardiology. Dr. Singh?
My name is Kat Singh. I am one of the maternal fetal medicine specialists here at the Cleveland Clinic. Thank you for joining us.
So Dr. Singh and I work very, very closely together in the Cardio-OB clinic. Dr. Singh, can you tell the audience a little bit about what Cardio-OB clinic and how it's special for us?
Our Cardio-OB clinic is something near and dear to our hearts. We have the privilege of taking care of women who either were born with heart disease or have developed heart disease, and we take care of these women prior to pregnancy, throughout their pregnancy, and after delivery.
And then we also tend to see very different categories of patients with heart disease. So we can see patients that were born with a heart defect with congenital heart disease, such as the tetralogy of Fallot, or patients that have acquired heart disease, such as cardiomyopathy or heart failure or valvular heart disease or coronary artery disease. We also see patients that have vascular disease like aortopathies, which is a dilated aorta. In addition, we do see patients that have arrhythmias, which is palpitations or abnormal heart rhythms. And to actually have the ability to take care of such a big category of different patients, we clearly have very different specialties of doctors that take care of these patients. So we have doctors that specialize in congenital heart disease. We also have doctors that specialize in vascular disease, doctors that specialize in acquired heart disease or heart failure and cardiomyopathy. In addition, what other doctors do we have in our clinic, Dr. Singh?
We are lucky enough to have many other members, including genetic specialists, both providers that take care of patients in pregnancy, prenatal providers, preconception, along with a large group of cardiovascular genetic specialists. We have neonatology to take care of the earliest babies if need be. We have social work providers. We have many OB/GYN specialists that we co-manage some patients with, along with a maternal fetal medicine subspecialist who manage a good group of our patients as well. And then we have our OB anesthesiologists who really help us get a lot of complicated patients safely through their deliveries.
And I also wanted to mention we do have pulmonary hypertension specialists and we have cardiothoracic surgeons, which is really important, especially in the very sick patients where they do need an intervention. We also have interventional cardiology, which is a specialty that I am involved in. So if you need an intervention in the cath lab, even during pregnancy, we're able to actually do that here in this facility. And obviously, a place that will have all these different types of specialties of doctors will have to be able to take care of these very sick, complex patients, and the Cleveland Clinic is a perfect place for that. Dr. Singh, can you tell us a little bit more about how the Cleveland Clinic is a perfect institution to take care of such complex patients?
Because of our variety of resources and our multiple providers, multiple locations, we just have a lot available to our patients. There's been some literature and support from American College of Obstetrics and Gynecology about categorizing different places based on levels of maternal care. And essentially, we have all of the subspecialty and resources here where we can provide the highest level of maternal care, the level 4.
And I do want to mention that at the heart of all of this is going to be the Cardio-OB nurse coordinator, who actually kind of is the glue to the patient, the doctor, and this institution, because this Cardio-OB nurse coordinator is the person who's going to first meet the patient, tell them which kind of subspecialty doctors that they need to meet in Cardio-OB clinic, bring them here, guide them through this big, big hospital and institution, and kind of be their main source of contact. So that is an extremely important person that we want to emphasize as the heart of Cardio-OB clinic. In addition to all of this, obviously, pregnancy in its own is very stressful to the body. Dr. Singh, can you tell us a little bit about what happens to a woman's body during pregnancy?
Yes, anyone who has had children before can attest to the many changes that happen to a woman's body during the pregnancy and postpartum period. And so there are so many changes to the amount of blood volume that we have, to how fast that our heart can beat, to how all sorts of different tissues and parts of our body stress and change. We're also more prone, pregnant and postpartum, to developing things like blood clots. And so basically a woman's health can be very different in the setting of pregnancy than her health was before pregnancy.
And as you can imagine, for example, women that have congenital heart disease, when they go through all these stages during their pregnancy with extra volume, if they have a tight valve, they might not be able to handle this extra volume well. If they have underlying arrhythmias or abnormal heart rhythm, with the increase in heart rate and all this stress, it can actually get worse and get exacerbated. Women that have aortopathies or vascular heart disease, as that kind of elasticity that happens during pregnancy to your tissues overall, are much more amplified in patients that have dilated aortas, where they're at more risk of having enlargement of the aorta or dissection. And you and I actually took care of a lovely, lovely patient who had a bicuspid aortic valve. So a valve that's not 100% normal. Aortic valve usually has 3. She had only 2. And she also had a dilated aorta. And she came to us in her 3rd trimester. And she was pregnant. And clearly the aorta had gotten larger with her pregnancy, which is something that we do see. And it was obviously a very scary time for her. But we were able to get her through this pregnancy very well. She was able to deliver via C-section a very healthy baby. And in that room, I remember clearly, there was essentially, I would say, at least 5 different disciplines of doctors in there, right? We had the
Yes.
CT surgeon, we had anesthesia, we had cardiology, OB, and we had genetics, and we had neonatal. So we had like a big, big group of people in one room just for her. She actually thankfully did not have any complications, and she came back later to have her surgical repair, and she's happily pregnant again. And this pregnancy is going to be a much, much healthier, safer pregnancy for her. Dr. Singh, remember any other patients that you want to share?
Absolutely. We've had so many. One that comes to mind is a patient that was born with 1 ventricle of her heart instead of 2. That can obviously complicate everything about how her body works and put her and the baby at very high risk throughout the pregnancy. She required a lot of support. A lot of subspecialists did require an admission prior to her having the baby to make sure she was safe and the baby was safe. And she had an uncomplicated delivery, an uncomplicated postpartum course. And now, despite having almost half a heart, has a healthy baby.
That's very true. I do have one more story I want to share because Dr. Singh would not share it herself. And we did have that one very sick patient who was in heart failure and had a clotting disorder. She had a due date to deliver the baby, but she went into something called preeclampsia 2 days before, which is a really dangerous condition where your blood pressure goes up, and it's dangerous for both mom and baby. And Dr. Singh was on vacation, and she actually cut her vacation short, drove all the way to the Cleveland Clinic, and delivered her patient. And I think that is the kind of dedication and passion that you want from your cardio-OB doctors. Sometimes you can have certain conditions that would make your pregnancy very, very high risk. And it's going to be a very difficult discussion to make a decision whether you would want to go with such a high-risk pregnancy where it's not just dangerous to you, but also to your unborn child, versus you would seek other opportunities or other ways to be a mom. And that is a kind of discussion that we will have in Cardio-OB Clinic, and I think we've had more than one of these together. And it's not always easy, but you do need the appropriate kind of guidance and to understand the risks and to understand that we are there to support you with whatever decision you decide to make, but we will give you all the information needed and all the guidance and support needed through that.
We've also seen cases of women who thought that they were not healthy enough to have a child, and with preconceptual consultation and optimization of their health, they might be okay to move forward with pregnancy. There will be risks as long as they know the risks ahead of time, but seeing our Cardio-OB clinic before and talking through these issues to find out what the woman is comfortable with, what can we improve on before a pregnancy, makes a lot of sense. And we've been able to get some women through a pregnancy where they were told previously it wasn't safe.
It's true. It's a common actually misconception that women with congenital heart disease are not allowed to have babies, right? But we see that quite often. It used to be back in the day, they were told if you have congenital heart disease, you can't have a baby. But now we actually take care of a lot of these patients, and a lot of them are able to have babies safely. But I think The emphasis is that preconception part. If you
Yes.
come to us before you get pregnant, we can actually guide you and make sure that it will be the safest pregnancy possible for both mom and baby.